Welcome to our presentation on the humanism or client-centered theory presented by Jessica Mullins, Melissa Crosby, Olivia Hurd, and Gina Black. The humanism or client-centered theory was developed by Carl Rogers in 1951. This theory embodies a humanistic approach to practice which stresses the potential value and goodness of human beings. Carl Rogers believed that people desire to fulfill their potential and become the best person they can be. Humanism, or client-centered theory, is essential to social work practice, and its principles can be seen in the NASW Code of Ethics. We have 5 key concepts that summarize the client-centered theory and their importance on development of a trusting therapeutic relationship. First, we have self-actualization, which is the want to change. Next is incongruence, which means having feelings of low self-worth. Next comes congruence. Congruence is a positive self-image that allows for movement toward fulfillment. Unconditional positive regard allows genuine communication. Carl Rogers believes unconditional positive regard describes a sincere communication of acceptance that lacks any condition that would interfere with care being expressed. And finally, empathy. Empathy is the ability to understand another person's circumstances. Incorporating these 5 key concepts will foster and promote the change process. Next, we'll talk about the 3 theoretical principles of the client-centered theory. Principle 1. Personal and social problems occur when people are devalued. Principle 2. Change happens in the context of an authentic helping relationship. Principle 3. People are capable of self-actualization when the conditions allow positive growth and change. The following 3 principles explain how human behavior drives the approach of client-centered theory. Incorporating the key concepts and principles of the client-centered theory will be helpful tools that we can utilize to encourage self-worth and positive changes in our client lives. As mentioned before, client-centered theory can be practiced in the micro, meso, and macro level. Examples being used at the micro level are as follows. Used with clients in individual counseling. The counselor should value the dignity and worth of the client. Another aspect of client-centered theory that the counseling center utilizes is the concept of unconditional positive regard. The social worker would be able to communicate to the client warmth and care that is not based on any conditions. And serving individuals that have dual relationship with Children's Protective Services. Now, client-centered theory can also be used on the meso level of social work practice. For example, by working with groups in parenting classes. Client-centered theory proposes that all individuals are naturally inclined toward self-actualization, so when setting goals with the client, the social worker will take into consideration the client's perception of where they need to foster growth and development. During parenting classes, the facilitator engages each parent and finds out what parenting skill they would like to work on and what are their strengths and weaknesses. Lastly, client-centered theory can also be used at the macro level of social work practice. The theory suggests that problems are created and exacerbated when individuals feel devalued and when power and control are absent in their lives. Parents participating in Head Start programs on the governing board making decisions for 3 different counties and all agencies. The parents are given power and control to make decisions about policies, procedures, and guidelines. By including these parents on the governing board, the principles of change happening in the framework of an authentic helping relationship is being fostered. Parents are empowered to enact change that will affect families on a macro level in 3 different counties and agency-wide. Strengths of the client-centered theory. Foundational principles align with the NASW's mission and core values of a client's right to self-determination, honoring the dignity and worth of every person, and displaying warmth and concern. The theory can be applied to all 3 levels of practice: micro, meso, and macro. For example, on the meso practice level, client-centered theory can be utilized as a community organizer with individuals and their families. On the micro level, as a mental health therapist, offers an important framework when working in multicultural settings. Limitations of client-centered theory is as follows. Client-centered theory has not been established as an empirical supported treatment. The theory is simplistic and leaves few guidelines to be followed. Time with clients is being reduced due to shrinking resources. This concludes our presentation. Thank you for watching.